Hi, my name is Rosemarie Perrault. I work as a neuropsychologist at the Jewish Rehabilitation Hospital, and today I'll be talking to you about the emotional changes that occur after a stroke. In today's session, my goals would be for you to better understand and recognize the emotional changes that most frequently occur after a stroke, the impact that these changes can have on daily life and recovery, and I would like to share some self-management strategies and professional resources that can be helpful. A stroke can cause changes in mood, behavior, and personality, and these changes can be noticeable for yourself and or for the people around you. Emotional changes following a stroke can be caused by a combination of factors, for example, neurological factors. Because your brain is the center of your emotions, any injury to it can cause major changes in emotions. You also have reaction to the stroke. So a stroke is a major life event, and it can lead to feelings of shock, of loss, and it requires a major adaptation to a new reality. And finally, you have personal history factors. Each person has their own experiences, their own personality that they had prior to the stroke, their experiences with disease, and cultural factors, all of which influence the way that we react to life challenges. Going through emotions, both painful and positive, is a normal part of your stroke recovery, and these emotions are perfectly legitimate. However, when our emotions get out of control, meaning that they become too intense or debilitating, they can cause distress and worry. They can affect our ability to think, to focus, to remember new information, and they can affect our body through physical symptoms. Therefore, they can affect our recovery. This is why it's important to talk about these emotional changes that can occur after a stroke, to normalize some of the things you may be going through, and to offer strategies and resources that can be helpful in navigating these changes. What are some of the most frequent changes that we can see in emotions following a stroke? One of the changes that can happen after a stroke is depression, which affects 30 to up to 55% of stroke survivors in the months or years after their stroke. Now, feeling sad, having mood swings, or crying are all normal after a stroke, and they don't mean that you necessarily have depression. What's different about depression is that the depressed or sad mood and or the loss of interest or pleasure in activities is prolonged, meaning that it lasts for at least 2 weeks and happens most of the day, nearly every day, and is accompanied by other symptoms such as loss of appetite, sleeplessness, feelings of worthlessness, and even dark thoughts. And they cause distress and difficulty functioning in your day-to-day activities. A few true or false questions about depression. First question: I will know I'm depressed if I cry all the time. True or false? The answer is false. Yes, feelings of sadness and crying are thought of as typical symptoms of depression. But in fact, in certain people, depression can manifest itself in other ways, such as anger or emotional bluntness. Second question: people suffering from depression could snap out of it if they really tried. True or false? The answer is again false. Depression is not simply about having the blues, and it's not something you can really will yourself out of. It is a chemical imbalance in the brain, and sustaining a stroke can cause or amplify symptoms of depression. Third question, once you're depressed, it will last all your life. True or false? The answer is, thankfully, no. There are efficient treatments for depression, such as psychotherapy and medication. Fourth question, antidepressants create a strong addiction. True or false? So this is a worry that many people who are prescribed antidepressants have. But in fact, if you take your antidepressants in accordance to your doctor's recommendations, and once you're ready to stop them, you discuss this with your doctor and follow a weaning plan, then it is possible to stop your antidepressants without having to worry about addiction or withdrawal symptoms. Thoughts around death and suicide are not uncommon after severe illness which may have threatened your life and may have left you with significant impairments. And these thoughts can come in different forms. For example, I would have rather died, or I can't go on like this anymore, or even, if I could, I would take my life. Although it can be quite frightening for you and for the people around you to have these kinds of thoughts, it's important to remember that thinking things like that doesn't necessarily mean that you will act upon them. It's still very important to tell someone if you notice these type of thoughts going through your mind. So whether it be a therapist, a physician, or a close one, it's important to assess whether there is a risk in the short term so that we can lower that risk, and then we can address whatever suffering is at the root of these thoughts. Most stroke survivors and the people around them go through feelings of grief after a stroke because of the multiple losses they face. Working through grief is a process that takes time and that has many different steps. So you may have heard of the different stages of grief, such as denial, anger, sadness, resignation, and acceptance. And we all go through these stages at different paces. And for some people, grieving starts relatively soon after the stroke. For others, it starts when they are done with rehabilitation. So really, everyone's experience is different, but what's common for everyone is that it's a process that takes time. So you really need to give yourself some time. And you can consider that you've reached the stage of acceptance once the feelings of sadness or loss are not as intense anymore, and you're able to better reconcile the hardships that you went through with the good sides of life. Stress and anxiety are two words that are often used interchangeably, but in fact, the two are different. Stress is the physiological reaction that you have when you perceive a threat. For example, a loud noise, an upcoming important meeting, or an illness or an accident. And stress is normal and necessary because it prepares us to face a threat by triggering bodily reactions, for example, increasing our heart rate and breathing rate, increasing alertness, and sharpening our senses. Anxiety, on the other hand, is a more vague feeling of worry and apprehension when we anticipate or we exaggerate a future threat. It's what many of us think of as the hamster in our head that is rolling and rolling and is hard to stop. And anxiety is also a normal emotion that most of us experience from time to time, but it can become a problem when it's chronic, so it stays for a long time, or when it's out of proportion with the actual situation, or when it interferes with our ability to go about our daily life. And when you have a stroke, well, there are a lot of things that can cause anxiety. Questions like, well, will I stay this way? Am I going to have another stroke? Is my spouse going to be able to take care of me? I'm afraid I'll be a burden on them. Will I be able to resume my activities? And so on. And anxiety can also be accompanied by physical reactions, especially when it's chronic. So physical discomfort, muscle tension, insomnia, and all of these things are very unpleasant, but they are not dangerous symptoms in and of themselves. And what's important to know is that there are ways to manage stress and anxiety. We actually have an information session about managing stress, so I encourage you to listen to this one if stress and anxiety are a source of preoccupation for you. Another emotional change that can happen after a stroke is called flat affect. Your affect is all the behaviors that express your emotional state. For example, facial expressions, emotional reactions like crying, laughing, smiling, and the tone of your voice. So when you have flat affect, your usual emotional expression goes blunt, and you may seem indifferent, as if happy or sad events didn't affect you. And this can be quite surprising for you or for the people around you. It's important to remember, however, that it's not because you don't show emotion that you don't feel emotions. So what you can do if you are affected by flat affect is to keep in mind that this is something that tends to improve with neurological recovery. It's also a good idea to inform the people around you so that they better understand what's going on. And if you're bothered by specific aspects of it, there are self-management strategies that can be worked on in therapy. For example, facial expression training in speech therapy. Now, something that is quite different from flat affect is emotional lability. And this is also sometimes referred to as pseudobulbar syndrome, pathological crying or laughing, and emotional incontinence. And it manifests itself as sudden and intense displays of emotion that are hard to control. For example, you could go from feeling calm and quite neutral to laughing uncontrollably or crying uncontrollably. And what people report is that it's not always related to the actual emotion you're feeling, or it's completely disproportionate with it. And it's often not appropriate in the situation. So this can cause quite a bit of embarrassment for you and quite a bit of surprise for the people around you. One of the first things you can do if you have emotional lability is to get informed. Ask questions, because understanding this condition better is the first step towards regaining control. It would also be a good idea to inform your family and your friends about it to avoid surprises or misunderstandings. When you feel an episode coming on, you can try to distract yourself with whatever is available around you, for example, counting ceiling tiles. You can also try breathing deeply and relaxing your muscles. And certain medications have been shown to be effective to reduce this symptom. Can there be positive changes after a stroke? Well, yes, it does happen, although we rarely talk about it. Many stroke survivors have described great feelings of joy and pride as they see their own progress and successfully reach objectives. Certain people have reported less anxiety following a stroke. And the fact that a stroke is a serious illness can cause certain people to reevaluate their lives to form new habits, new ways of thinking. It can serve as a wake-up call or an opportunity to reassess priorities or your values. I would like to end with a list of take-home messages and resources. So the first message I want to convey is that all your feelings are okay, they are valid, and they express a need. So there are no good and bad feelings. What's important is to learn to recognize your feelings and to express them. It's also very important to avoid isolating yourself, which is what a lot of us have a tendency to do when we're not feeling well. But what's most helpful is to actually reach out and inform others about your condition and the way you're feeling and ask for help if you need it. It's also a good idea to get to know the recommendations regarding energy and stress management, medication, sleep, physical exercise, etc., because all of these things have an impact on emotions. If you feel like you could benefit from professional help, then there are different people you can reach out to depending on where you are on your journey. If you are still in rehabilitation at the Jewish Rehabilitation Hospital, then you have access to a psychologist or a social worker. If you are done with your rehabilitation, then your first line of help would be your family doctor. You could also reach out to the CLSC or to Info Social 811 option 2. The CLSC can put caregivers in contact with caregiver associations. In Laval, there is an association called Aphasie AVC Laval, which is composed of stroke survivors. And you could go to the Heart and Stroke Foundation, and they have website filled with information, and they have support groups that they can put you in contact with.